Anatomy of the urinary system. The urinary system consists of the following: kidneys, ureters, urinary bladder, urethra. The kidney bin-shaped organ. It lies on the posterior abdominal wall at the side of vertebral column. It measures 4 by 2 by 1 inches. It has anterior and posterior surfaces and medial and lateral borders. Right kidney is lower than the left because of the liver. The level of kidneys varies with respiration of about 1 inch. The kidney cone, renal hilum, is found at the medial concave surface. Renal vein, renal artery and ureter are found in the hilum in anterior-posterior order. Lymphatics and sympathetic nerves pass through the hilum. Renal sinus. All structures pass through the hilum. In addition to small amount of fat and the pelvis are found in the sinus. Suprarenal glands, kidneys, and ureters and their vessels are retroperitoneal structures. Renal capsule formed of dense connective tissue surrounding the kidneys for support and protection. Perirenal fat. A layer of fat surrounds the kidney outside the renal capsule. Kidneys, suprarenal glands, and perirenal fat are enclosed by facial membrane called renal fascia. The two layers extend medially to enclose the renal vessels and blend with vascular fascia. The two layers extend inferiorly to enclose the ureters as periureteric fascia. A layer of fat surrounding the kidneys, ureters, suprarenal glands external to renal fascia called perirenal fat. Perirenal fat, renal fascia, perirenal fat and some collagen fibers hold the kidneys in fixed position. Superiorly, renal fascia is attached to inferior diaphragmatic fascia. Internal structure of the kidney. Each kidney consists of outer cortex, inner medulla formed of renal pyramids with apex forming renal papilla. Cortex extends into medulla as renal columns. Renal pelvis fills most of the sinus. Major calyces. Minor calyces. Anterior relation of the kidney. Right kidney. Suprarenal gland. Liver. Duodenum. Right colic flexure. Ileum. Left kidney. Stomach. Spleen. Splenic artery. Pancreas. Jejunum. Left colic flexure. Anterior relation of the kidney. Right kidney. Left kidney. Posterior relation of the kidney. Diaphragm separates the kidney from the pleural cavity and 11th and 12th ribs. Psoas major medially. Quadratus lumborum in the middle, transversus abdominis laterally. Subcostal, iliohypogastric and ilioinguinal nerves descend obliquely behind the kidney. The ureter is a muscular organ. Extends from renal pelvis in abdomen, crosses the pelvic brim at common iliac artery bifurcation to the urinary bladder. It 10 inches in length. On the back, extends along a line from a 0.5 centimeters from spine of L1 to posterior superior iliac spine. The ureter cone, the abdominal part is retroperitoneal. It runs close to the tips of transverse processes of lumbar vertebrae as seen in contrast radiographs. It passes vertically on psoas muscle. It enters the pelvis crossing the external iliac artery. It shows 3 constriction along its course. Between ureter and pelvis. At crossing the external iliac artery. At entrance to urinary bladder. They are the sites of obstruction by renal calculi. The ureter cone, ureter runs on the lateral part of lesser pelvis. It runs parallel to medial part of greater sciatic notch. At level of ischial spine, it turns anteromedially to enter the inferior surface of the bladder in inferior medial direction. The entrance is 5 cm apart on external surface and 2.5 cm apart at internal surface. Oblique passage creates a sphincter-like structure at lower end of ureter. Anterior relation of the ureter. Duodenum. Terminal ileum. Left gonadal vessels. Right gonadal vessels. Left colic vessels. Right colic vessels. Sigmoid colon and mesocolon. Ileocolic vessels. The urinary bladder. It is a hollow muscular organ. It is a pelvic organ after puberty. It lies behind and superior to pubic bones, leaving retropubic space in between. It is divided into apex, fundus and body. It has 4 surfaces, superior, posterior, base, and 2 inferiolateral. It is freely movable except at the neck, that is attached by lateral ligaments of bladder and puboprostatic ligament in male and pubovesical ligament in female. Body. Apex. Fundus. The urinary bladder coned. Posterior relation in male. Vas deferens. Seminal vesicle. Rectum. Rectovesical fascia. Peritoneum. Posterior relation in female. Vagina and part of uterus. Superior relation in male. Coils of ileum. Sigmoid colon. Superior relation in female. Uterus. Lateral relation. Obturator internus muscle. Levatorani muscle. The urinary bladder coned. Anterior relation. Symphysis pubis. Retropubic fat. Inferior relation. Prostate gland. The muscle of the bladder wall is called detrusor muscle. It is thickened at the neck to form involuntary internal urethral sphincter. Trigone is triangular area where the 2 ureters and urethra open into its singles. Blood supply of the urinary system. Kidney. Renal arteries are paired branches, arise from aorta at the level of intervertebral disc between L1, 2. Right one longer than the left, passes behind IVC. At the hilum, each one divides into 5 segmental arteries, each supplies a renal segment. Renal segments are independent in their blood supply. Blood is drained by segmental veins to renal veins. Blood supply of the urinary system coned. Abdominal part of ureter. Ureteric branches from the renal artery are constant ones. Other branches from gonadal, aorta and common iliac arteries. They give ascending and descending branches that anastomose with each other. Veins are drained by renal and gonadal veins. Blood supply of the urinary system coned. Pelvic part of ureter. Ureteric branches of common iliac, internal iliac and gonadal arteries. Constant branches come from inferior vesicle and, in female uterine arteries. Veins are corresponded to arteries. Blood supply of the urinary system coned. Urinary bladder. Superior vesical artery. Inferior vesical artery. Vaginal artery replace inferior vesical artery in female. In male, venous plexus around the bladder and prostate drain into inferior vesical vein. Also, superior vesical vein drains the bladder. Both veins drain into internal iliac vein. In female, venous plexus around bladder drain into vaginal or uterovaginal vein and then to internal iliac vein. Lymphatic drainage kidney into left and right lumbar. Aortic and caval, lymph nodes. Upper ureter. To kidney lymphatic sort. To lumbar lymph nodes. Middle ureter. To common iliac lymph nodes. Lower ureter. To common, external, and internal iliac lymph nodes. Pelvic ureter and bladder. To internal iliac lymph nodes. Nerve supply. Parasympathetic fibers leads to contraction of smooth fibers in ureter and bladder and relaxation of smooth fibers in internal urethric sphincter. Sympathetic fibers cause the opposite effect. Sympathetic fibers to kidney are vasomotor comes from renal plexus. Parasympathetic fibers from S24 form pelvic splanchnic nerve. Sympathetic fibers from L12 form inferior hypogastric plexus. Male urethra. It is 20 cm long in male from the bladder neck to external urethral meatus. It has a torticourse. It divides into 3 parts. 1. Prostatic part. Widest portion. It is 3 cm long. Most dilatable part. Ducts of prostate gland and ejaculatory ducts open in it. 2. Membranous part. Lies within urogenital diaphragm. It is 1.5 cm long. Least dilatable part. Male urethra coned. 3. Penile part. It is 15.5 cm is surrounded by erectile tissue of bulb and corpus spongiosum. It is dilated at the end as navicular fossa bulbourethral and penile glands open in it. Female urethra. It is 4 cm in length and 6 mm in diameter. Extends from neck of bladder to external meatus. It passes under the symphysis pubis. It lies anterior to vagina. It opens in the vestibule anterior to vaginal opening. Paraurethral glands. They are mucus-secreting glands located at the sides of external meatus. It is easily dilatable. It is straight. Blood supply of urethra. Male urethra. Female urethra. Prostatic branches of inferior vesicle and middle rectal arteries. Dorsal artery of the penis. Arteries of the bulb of the penis. Internal pudendal artery. Vaginal artery. Nerve supply of urethra. Parasympathetic supply. From pelvic plexus made of S24 roots to form pelvic splanchnic nerve. Sympathetic supply T12L12. Form hypogastric plexus and then form pelvic. Somatic supply. Pudendal nerve from sacral plexus. Sensory and motor to external urethral sphincter.